welcome everybody here today on behalf of Sigma Theta Tau and S&A. I'm going to turn it over to Laura Odom to welcome our keynote speaker, Dr. Overholt. So, please.
Hi everyone, my name is Laura Odom, and I've had the privilege of working with Dr. Overholt for the last 11 years at the Allergy and Sinus Center. He started the practice in 1970. The practice has grown to over 40 providers, and over 30 of those providers are nurse practitioners. So he's very aware of our ability as an advanced practice nurse and loves having us around, I think. He is going to talk today about medicine in the future, and I think we'll be really excited to hear what he has to say. So please welcome Dr. Overholt.
I want to thank Sigma Tau Theta, Honor Society, UT Nursing, for allowing me to come and talk to you about medicine in the future. What's it going to really look like in the future? Because things are changing dramatically. About a year ago, 9 months ago, Laura asked me if I would give a talk to the association. A year or two prior to that, I was having some orthopedic medical problems. I had some problems with my ankle. I ended up having an ankle fusion. There was a chance that I was going to have a BK amputation, where I would have to have an artificial limb, and the physician, orthopedic physician, said, Dr. Bob, you would do great with that with your mental attitude. And I began looking at the internet, and I want to show you some of the things I saw that got me interested in medicine in the future. First, let me tell you about my objectives today. My objectives today are going to be prepare for the future, because it's going to change dramatically. We'll be using cell phones in medicine. How many people that have a cell phone with them right now? You can keep them on if you want, no problem. Wearable healthcare technology, we'll be learning about that. 3D printers, robotics in medicine, genome and gene therapy, stem cells, and last of all, our artificial intelligence. So we're going to try and get through those. We'll get started right here. My first slide, if you'll look at the upper right, you will see, and I've got a pointer right here with me too. You'll see the gentleman right here. He's got artificial limbs. This was a sophisticated athlete who was out skiing and was caught in an avalanche. And in the avalanche, he was hypothermic for 2 days. They dug him out, and when they warmed him up, he didn't have any feeling in his legs. And so he had bilateral amputation. When he had bilateral amputation, he was depressed. He was an athlete, couldn't do anything, and so after going to many doctors, he went up to MIT and said, let's develop some medical technology, some biotechnology that will allow me to walk again and do what I want. And so at that time, we didn't have so many of the people that were in war conflict that were having their legs blown off. So he was a bilateral amputee, and what he did was, he simply got an artificial limb. But he wasn't satisfied with that, so he put a computer on it, and the computer would tell when he was stepping down the stairs or when he was stepping up so that he could walk faster. He wasn't satisfied with that. So what he did, he took the perineal nerve on the outside of the leg and attached it to the computer, and the nerve began to fuse with the computer in his artificial limb that says, tell your leg to walk. And he says, and now I can jump like this because my brain is telling my legs what to do. Not that I'm lifting the leg, lifting it over here and doing this. I then began to look a little bit more about the time Laura called me, what was available, and there was a gentleman, a cardiologist, his name is Eric Overholt. He's now the editor of Medscape. And Dr. Pilkel said, throw away your stethoscope. How many nurses here use stethoscopes? He says, throw away your stethoscope. Because what I want you to do is use your iPhone, and I want you to hook it up to a little pencil that's a sonogram, and I want you to look at the echocardiogram of the heart at the bedside. So what they did is they took 3 medical schools, and they took students at those 3 medical schools, and they had them learn the sonogram iPhone. Mine's ringing right now. It's 20794, one of them. So the echocardiogram, they had the students learn for 6 months. And so they were, medical students were efficient for 6 months, and they challenged the chief of cardiology on heart murmurs and what's going on in the heart. And the chief of cardiology had a stethoscope. Guess who won 10 out of 10 cases? The medical students that were using a sonogram at the bedside. So did they have a stethoscope? No. Now let's say you and I take the information that we got from the echocardiogram that's there. It's just pictures of stuff. It's just information. And we fed that up into the sky. This is going to be the end of the talk. We fed that up into the end of the sky. We're up in the iCloud. There are trillions of bits of information. And part of that will be the information of trillions of echocardiograms that were done at bedside, showing that what you're seeing right there can be analyzed up in the cloud and can send you a message down there. You don't even know what you're reading, because it's going to tell you what the murmur is, what the ejection fraction is, what the left ventricular muscles look like, what the septum looks like, if there's any murmur, the flow of the heart. That's available right now. This is the fusion to the muscles on the legs. And here it is with the patient. So let's go on, because I can see I'm not going to be through. I was blind, but now I see. If you'll look right here, you will see that this gentleman has glasses like he's blind. There's something right there. It's a camera. It's a camera with many chips. The camera with many chips can look out in the room, but how's he going to tell what it is? Well, what they do is they fuse into the brain, back into the occiput where our vision is, so that he bypasses the retina. He goes back into the optic nerve behind the retina, which goes to the brain, and now he can see anything by moving his head because he's got a camera. He's got no eye. We're going to talk about, can we, with 3D printing, develop eyes? 3D printing. What do you think of 3D printing? It's printing that comes in 3 dimensions. We're going to make it a little bit better than that later on. So now we have wearable clothing. Under Armour, $3 million they're putting into clothing, and the clothing will have electronics in it. You've got the Fitbit watches. How many own it? How many people own a Fitbit watch? So that information that you're getting is going up into the cloud, not with your name on it, but it's got your age, it's got your sex, it's got your heart rate, it's got your respiratory rate, it's got what you're doing, how active you are, what you're like when you're asleep, and it's going up there and it's calculating millions of people that have watches up there in the cloud with trillions and trillions of information to come back and say, this is what happens to a 28-year-old person who is exercising 3 days a week versus a 20-year-old person that's just not being active. So it's going to tell us with information that we can't even perceive right now. It's going to help our health. WITD we'll talk about in a minute. Remember the words WITD. I'm going to tell you what that means in a minute. But there's a company called Athos, A-T-H-O-S, and Under Armour. They're spending over $3 million just in the clothing to have wearable technology. So you're going to put a shirt and go out and exercise. But we're going to be putting on our undergarments that will have electronics that will tell us how often our bladder fills up, or how long it takes us to empty our bladder, or what our heart like, what our pulse like, if we've got obstructive sleep apnea, we've got arrhythmias at nighttime, and all that's going to go up in the cloud. It's going to come back and tell us, where's the doctor? We're going to be taking charge of our own health, and the iPhone's what's going to do it now. So let's go on. Houston, we got a problem. Telemedicine, we've had telemedicine for a long time, it hasn't been very effective. But what you can do out in the periphery of medicine, you can take a picture and you can send that picture to a group of people in a computer. Are they doctors? Well, let's say, for instance, do we have a dermatology problem? We've got a weird old rash. I've never seen this before. I have no idea what it is. So I'm going to send it to Houston. Not Houston, this will be UT Medical Center, where some of their people, doctors, will be looking at the image that we send them of this dermatology rash, and the computer will say, I've seen this 3 million times. This is a delayed hypersensitivity reaction. It's due to one of the following medications. But you've already sent in with that medicine. It's most likely cause resistance to an ACE inhibitor that's causing a rash. You need a doctor. Remember, WITD. Neurologic exam, somebody that's like this, or somebody that's got, what's this? Who knows what this is? Choreiform movements. It's Huntington's chorea. It's people that have spontaneous movement. I had CDMs back in the day before with rheumatic fever, all while you're at the bedside. You have the answer right there. When will that be? We'll talk about that later. It is available, not for action right now. So where is the doctor there? Gastrointestinal, we now have, you can swallow a little camera, and the camera takes pictures all the way through. But it doesn't evaluate those pictures. The doctor has to look at, there's a polyp right there. It is, there's gastritis. The pictures will go to the computer, which will have trillions and trillions and trillions of pictures that this camera has taken on other esophaguses, or small bowel, or colon. And will tell you the likelihood of whether or not this is, or it'll tell you what it is. We'll be talking about nanorobots. Nanorobots are 1/1,000,000th, about a millionth of the size of a hair follicle. And we're going to be putting those inside the body, and they'll be swimming around in the body. And they'll be able to see, or smell, or treat cancers. We have dogs now that they can sniff out lung cancer, they can sniff out prostate cancer. Dogs just by sniffing the urine. If a dog can do that, think what a computer with trillions of information can do to help identify a disease process in the future. Oh yes. What does WITD mean? Who can figure it out yet?
Where is the doctor?
Where is the doctor? The doctor is not there. Do we need the doctor to do all of this? Nah, the doctor's stupid. You know, there's no way in the world he can know all the information that's up there in the iPhone. The most brilliant physicians cannot compete with the knowledge of a computer. But they can say, how are you doing? What can I do to help you? We'll be talking about artificial intelligence. We'll talk about the pros and cons of artificial intelligence. Okay, virtual reality. We need to change our teaching. You no longer going to go to class and look at lectures. What we're going to do, supposed to clap at that. What we're going to do is we're going to put some glasses on you, some virtual reality glasses. And the glasses are going to be able to look inside the body, and they'll be able to look at every blood vessel and where it originates and where it ends. They'll be able to look right inside every muscle and look at the tendon and go inside the tendon and see the cellular structure and see what tendon tears look like and see how it attaches and what happens to the muscle movement. You'll be right in there with virtual reality. Now, we've got a lot of computer games right now. We'll be doing medicine like that. Your teaching will be with virtual reality, and we'll be not only down to the vessel size, but we'll be inside the vessel, and I'll show you where that will be. This is the cutest guy in the world. You know, he's got a virtual reality game that he's playing. He's like this, you know, with a big smile on his face. You can't see the smile. But we'll be doing that. You'll be doing, oh, that's what the blood looks like. That's what the aortic valve looks like. There's what a bicuspid aortic valve looks like. There is how to touch the valve. There's how it fuses together. This is like what's the structure on a cellular level of the heart valve. You'll all be doing that with your glasses. No way to do that otherwise, unless you're on the table, unless you're operating and you see it, unless you're at a cadaver side. That would take you a long time and we don't have a supply. We're going to be looking at how we're going to supply organs in the future. There will be no deficiency of organs for transplantation. Here is a simple glass that has a computer right here, a computer chip. You can be looking at that, and your brain has that computer chip. I call it that building. That was the building made of. How many rooms are in that building? How many people are inside that building? How many are males and females? How many are sleeping? What's their respiratory rate? Do they have obstructive sleep apnea? What's happening in their lungs? Do they have pulmonary fibrosis, or do they have bronchial asthma? Just the process. So we'll be able to do that without question. Robots, nanorobots. You've all seen the guy's name that he has great name. It's called the Da Vinci robot. It's for prostatectomies. And so here's a doctor with his little joysticks, and here is the surgeon who's right here with the robot. Now here we got a doctor who's there. But let's say we've got 10 of these robots, and we've got them over in foreign country, where we need to do prostatectomies. And there may or may not be one doctor there and 10 robots in case the robot is an artery and you're in crisis management provider. But you'll be able to look at the crisis management with optics that the computer has. It'll tell you where the bleeding is, what artery is coming from, whether it's an artery or a vein, what you need to do, what the robotic surgeon needs to do to stop that, medicines that we can send in from the robot that they're able to stop the bleeding. Where is the doctor? Look up here, what is that? Well, it's an eyeball. When you see the eyeball, you can't see it from where you are, but there's a little dot right there. You can see that dot, you don't need glasses. So we're going to look and see what that is, because that's a nanorobot. It's in the retinal artery. It's the posterior retinal artery that goes to the retina. The retina is the back part of the eye, where we see. It's got to be nourished. It's nourished by the retinal artery. If you get a blood clot in that, then that stops the blood supply to the eye. And when it stops the blood supply to the eye, on that retinal artery, what happens? Raise your hand. What happens if you cut off the blood supply? My wife has never asked one person. Raise your hand. What happens if you take the blood supply away from the retina? The retina uses more oxygen than any of, even the brain. It needs to be oxidized. It needs that nourishment. So if you don't get it, what happens to the eye? Dies. You become blind. Gentleman who sits beside me in choir woke up and couldn't see. Ends up he had thrombosis of the retinal artery. Well, let's see what happens in the future to that retinal artery. Here we've got a blood vessel. And in the blood vessel, we have sent into the bloodstream a nanorobot. And this nanorobot can go and attack and dissolve that thrombosis, that blood clot that's in the retinal artery, and we can reestablish blood flow there. Now we've got to do that quick in this case, but let's go down to the heart. The doctor recognizes chest pain, and the electrocardiogram recognizes that there's ST segment depression and that you've got an abnormal electrocardiogram, and he takes you to the cath lab. In the cath lab, they visualize the coronary artery, and then they put in, the old days they used to do balloons, they put in stents. Now they decide that there's too much, and they do bypass surgery. What if we send a nanorobot? And we guided the nanorobot with these magnets, and the magnets guide it through the blood vessels. Millions of inflammation of blood vessels tell us how aggressive we're going to have to be. And we can dissolve that clot in the coronary artery immediately. WITD. Where's the doctor? Do we need him to do the cath? Do we need him to look at the electrocardiogram? If we go back to our cell phones now they're out. One of my friends came down to Denver. Put your hands, those are the two electrode areas. You put your thumb on them, and it takes the warmth of his thumb, and all of a sudden it begins to read an electrocardiogram. He saves it and sends it to his cardiologist. So if he has an arrhythmia, or he thinks he's got an arrhythmia, instead of putting on a Holter monitor, he just makes this right. The computer's going to tell us what's going on with the electrocardiogram, because it looks at 1 million a day. Where's the cardiologist looks at it and analyzes it? Does a good job, great job. Not as good as a computer. The computer has more intelligence because that's the way it's built. Doctor may be sleeping, may have been all night working. So in this case, in the future, will there be doctors? Will it be the nurses that are sitting there holding your hand and saying, which computer am I going to guide you to? Heart computer, stomach computer, allergy computer, brain computer. So you can see the nanorobot here is attacking this blood clot. Well, let's just say we don't want to attack, we want to deliver medicine. Let's just say instead of a blocked blood vessel, this was an organ that had cancer. Can we send, instead of chemotherapy that we send to try and go around the tumor, can we send a nanorobot with specific medicine to laser out or to do whatever in the future we're going to do? Are we going to be able to genetically control that cancer and its production of its own personality, which is proteins on its edge? So with that in mind, will the nanorobot be taking care of cancer? Where is the doctor? Let's see what time is it up here on the cell phone. Okay, who knows the guy on your left? Raise your hand, you know who that is. Yeah, it's all the youngsters know. That's Robert Downey. Robert Downey is Iron Man. The Iron Man met this little boy that had thalidomide-produced phocomelia. Thalidomide used to be a sleeping pill, and if you took it when you were pregnant, you may have a child without an arm. So this child had phocomelia, did not have an arm. So he saw Robert Downey in a wish list, and Robert Downey said, "Oh, goodness, what can we do?" So he took a 3D printer, made an arm. Just a 3D printer. This is a mechanical arm. This is the same kind of mechanical arm that Hugh Herr had with his artificial leg that he ended up putting in the perineal nerve. Robert Downey is looking at this little child who has, through the foundation that he had in order to have 3D printing. Well, so a lot of our soldiers now, a lot of people now, are producing artificial limbs for $300. That you can put one. So the 3D printer can put out the exact arm that this guy needs. Now he won't have blood vessels. It just has wires and attachments so it'll allow it to move properly. So the 3D printer can do that. Or this was not available when you asked me to give the talk. So I've been, the information that's up in the cloud is increasing exponentially. So what we knew a month ago would take 8 degrees, by degrees I don't mean temperature, I mean school degrees, a month ago, in order to have the information that now we have an artificial intelligence up in the cloud that lets people do something. It would take 8 years of degrees. By the time you get 8 degrees, 4 years of degree, 32 years, whatever, it's going to bypass so fast. The amount of information is coming out so fast exponentially that the last part of my talk I was looking at last night, because it has changed dramatically in the last month. And so we'll talk about what I was looking at last night. And I hope that this lecture will allow you to start looking at topics of healthcare that your cell phone and the internet and YouTube will allow you to explore the future. Where I want to go. This is a 3D printer of a plastic ear. And it's just the outline of an ear. This is not a ear that's functional except when you put the wires to it. And the wires can go to the cochlear, where you can move the ear. Again, so you can bypass the ear. But here we have a 3D printer. Now a 3D printer puts in ink or something, and you can have a 3D object. What if we put in living substances, stem cells, put in subcutaneous tissue, extracts, substrates, and in the printer we begin printing out an active organ. What if the 3D printer slices through kidney 1,000,000 times and gives you 1,000,000 slices and puts them together as a functioning liver or a functioning kidney? And indeed, 1 month ago, this is a functional kidney that comes from a 3D printer. Oh, how frightening. Kidney, last time I looked at my books, because it had nephrons in there, and proximal tubules, and distal tubules, and glomerulus, and blood vessels going on there, and it had electrolytes that came back and forth. That's what this living tissue is doing in this kidney. If I'm harvesting a kidney in a cadaver, I got to jump on a plane, go get into the sign the plane, pick up the kidney, bring it back, and I should be broken. Bring it into the operating room. What if this 3D printer at UT Hospital has 42 kidneys ready to put in a kidney transplant? They got 85 livers, and they made them last night. Will we need a transplant surgeon? Will we need the doctor to go take out the kidney and the liver and the guy that just died in Omaha, Nebraska? There will be in the near future, we'll talk about what that means, no need for transplant organs. It will be printed out in 3D printers, printing out live stuff. Scary. Who's going to get hold of that 3D? This is an eyeball. This is the top of the eye right here. Here's some of the muscles that attach to the eye. So the eye will move. 3D printer did this with moving muscles with the eyes. Where it can be used for an eye. You don't have to have the microchip camera like we did in the first picture. I was blind, but now I see. We will be 3D printing out live eyes that we can place in the eye. So if somebody, an automobile accident, fracture the back of the orbit, the line. This is a new kidney. This is 3D printing. It is just beginning. When we look at artificial intelligence, when we look at robots, humanoid robots, people that can do this and can move their head and talk, we've all seen these in the movies. But one of the things that they can do is you feed them information, and they can spit out the information, and they can do whatever you tell it to do, but they can't think. They can't have emotions. They can't say, I don't want to do that. Last night, I was looking at a 3D printer. It starts with nothing. It makes this person's head. It's in the live brain. Puts in the connections from the brain to the spinal cord. It builds the spinal cord, it builds the body. Builds the stomach, builds all the organs. Builds the legs, builds the feet. Begin to talk to this person. You say, sing me a song in Japanese. Sing me a song in Japanese. Tell me, read me Poe's Raven, Nevermore, Nevermore, in German. Computer starts doing that. Perfect. I want you to describe the origin and insertion of the vastus lateralis muscle in the quadriceps group. The computer speaks it out. Language. It says, now start walking. And this she's learning to walk. It's a sheep. She learns to talk. She learns to think of the questions you ask. She learns a conversation between two people. And then she is asked to do something that she doesn't want to do. And she says, tears in her eyes. I don't want to do that. Was that inscribed in her intelligence? Was she able to take different situations? We will have artificial intelligence that can make decisions that are emotional. We can do it right now. We can take rats and we can send to the hippocampus, where memory is. We can send information that says you'll be frightened by a certain thing. If we can teach fear, we can teach love, we can teach emotions. So artificial intelligence, Bill Gates said, this is great. It's great that we'll be able to have robots that will be able to think and will be able to perform and be able to do tasks. And then 2 months later he said, it may be the worst thing that could ever happen to mankind. Because if you can take away some emotions, and you can tell the computer to do things that the person that's been printed out by 3D machine to do something that's wrong, and you took away their ability to understand that wrongness, then you could have some situations that are very, very bad. So Bill Gates says, maybe that's not really a good thing. He had already hired somebody and a team and put out huge amounts of money for the development of artificial intelligence. You can go to YouTube and Google artificial intelligence and just look at what's available in the very near future. Where is the doctor? We are now in an information age. When you go to your cell phone, it can tell you how fit you are, what you ate, you missed your medicines, what your cardiogram is like, if you have obstructive sleep apnea. That's what it can do now. In the future, it may be where you use your cell phone to get rid of the problem you have. It's analyzed by $1 trillion. And by the time you have that problem, I'm old enough to have it now. We will be so far advanced that you'll be thinking and your brain will tell you how to heal an ulcer. Your brain will go down and change. The intelligence will guide the physiology of the body. And so we have a huge future in medicine because of the iCloud, which has trillions of facts that will allow us to have artificial intelligence. So how do we prepare for the future? As a medical professional, be a doctor. Follow the main trends and be up to date using digital methods. You all got your cell phone, you all use it, you all communicate. You can't leave home without it. It can tell you where you are in the mall, it can tell you any fashion you want. It's cheap and around you, you can't ask for questions, you can't Google and find the answer. There are 17,000 medical application apps. 17,000. How many do you have on your phone? I mentioned you don't have 17,000. There are 75 that have been approved for medical care. And this was probably 2000, either late 2013 or 2014. So they're coming out every day because information is available for you to do. You want to change the color of your hair? I just want hair. It won't be hard. My cell phone will just tell me, this is what you do to grow hair. You just got to think it. You know, it's real stuff my life. Look at my hair. So keep up to date with your cell phone. Keep up to date with the internet. Keep up to date with YouTube. Use it for information for medical purposes. Use it in a way that you can be a wonderful professional, one who's taking care of people, one who is healing. It's the greatest thing to do. I tell a little story here. I had surgery back in the 70s. And at that time, it was nasal surgery at that time. And there was a lot of bleeding, and you swallowed a lot of blood, and woke up in the middle of the night, blood, you vomited that blood, you were sick, and they gave you pain medicine and all that. I was macho. I didn't want any pain, I didn't want any. Well, nurse came and said, for sure, you know, that's what's up. She said, doctor. I said, yes. Did you hold my hand? And this little girl held my hand, and I could just feel the love that she had by sharing that with me. That's, instead of documenting on paper, that's what my nurses are here to do. To be able to touch somebody and say, I love you, you are. That's what we're here for. Embrace technology in a comfortable way. Don't be scared of it. It's going to be something that says it's going to make your life easier. Know how technology is going to make your life easier. It'll make your work more efficient. This is a quote of Bill Gates. I want to read it 2 or 3 times. We always overestimate the speed of change. Oh my goodness, all this is going to happen. I'm going to be a doctor and I'm never have a job. And all it'll be, the computer will be there. I need to change professions. No, it's going to be a long time. However, the next sentence says, we always underestimate how soon the changes will be. My father lived in our house. He was a physician. He had atherosclerosis, had cardiovascular disease. He woke up one night saying, Bobby, Bobby. I came into the bedroom, there were nitroglycerin pills all on the bed, and he was having a heart attack, and he was dying. And we called 911, the ambulance came. And I taken his blood pressure, and we took him to the hospital. They didn't have bypass surgery then. They didn't have cardiac cath then. They didn't have angioplasty then. And they didn't have stents then. They didn't have nanorobots that we're going to see later on. And then he died. He died after he was in the hospital a couple of days. He died. And somebody jumped up on his chest. They were pushing on his chest, starting CPR. And there was some Overholt members there, and he said, off. So we'll make decisions with artificial intelligence that are going to have huge questions, ethical questions for you as a medical professional. How long do we live? In the future, this was 2 years ago. You walk into the doctor's office and he'll say, how you doing? I'm here for my physical. The doctor will say, well, sit down a minute, we need to talk. How long do you want to live? Do you want to live to be 130? Or do you want to live to be 150? No, I don't want to live to 130. I have bad knees. And, I'm getting what I don't think is good. And my liver's got problems. I had a heart attack 2 years ago. Oh, don't worry about that. We'll send a gene vector up to your heart, and that will replenish your heart muscle, and so you'll have a brand new 20-year-old heart. Yeah, but my knees have got a lot. No problem. We'll send a virus down to your knee, the chromosome, so-and-so, and we'll grow cartilage there. Or we'll send through the bloodstream a nanorobot. It's going to produce cartilage in that area. He'll take a stem cell that is made by joints. Now, right now, at Duke, for the last 10 years, they've taken cardiac stem cells. So we have bone marrow stem cells that are pluropotential. That means you start with one little cell and it ends up somehow knowing how to make a head, how to make a heart, how to make a belly, and how to make a foot and top. But now we're knowing that the skin has stem cells and the heart has stem cells. So if we can take a heart stem cell and we can inject it in somebody that's got congestive heart failure and a ventricle, the heart is just twice as big, it will begin to grow new heart muscle. The problem with the cardiac stem cell is it dies in about 2 weeks. We'll be able to have a new heart however often we want. We'll be able to have a new knees however we want. What's the difference between 130 and 150? Man, we're through with Alzheimer's, but 130 brain disease. They're still not as good as, well, we've got artificial. Okay, 170. So we may be living functional. If so, what will we be eating if we populate the earth with robots? And you see in these movies where the robot over you. What are we going to do when you overpopulate? We'll be able to, we won't need food. We'll be able to provide nourishment. So we always overestimate the speed of change, and we always underestimate how soon that change will be. No matter how important the digital role will play in your lives, human touch is and will always be the key to the doctor-patient relationship. Always remember that human touch is not everything. Summary. You are the future. Information is the future. Use it. Be gentle with it. Don't be afraid of it. Let it help you provide care. It's the best care in the world. Thank you. I hope that we've met the objectives and you've been stimulated about the future of medicine and how wonderful it's going to be. Thank you for listening. You may not know this, but this is Taylor Swift. I'm flirting with her out in the hall.
Yeah, I wish I was Taylor Swift, at least had her money here. Does anybody have any questions for Dr. Bob? It just seems so out there, doesn't it? It's kind of crazy to think about the future. I just want to say, we want to thank Dr. Bob for taking the time to come and just share some of his information with us.
Before you continue, let's say there's a new conference that's in Los Angeles, and the new conference is a week later. You really want to go, but you can't afford the flight. And so what you're going to do is, in the future, you're going to walk into a phone booth. In the phone booth, you're going to push LA, and you're going to transform your matter into Los Angeles, where you'll be reformed perfectly as the person you are. In Scientific America, 5 years ago, they took a block of wood and they took it cell by cell and moved it 20 yards over there by cellular transformation. So you and I will travel like that in the future too. So don't worry about that conference in Los Angeles.
I just want to say that in honor of Dr. Bob being here today, Sigma Theta Tau is going to present a charitable donation in his name to Precious Prince, the project. Are you familiar with Precious Prince, Dr. Bob? Precious Prince, for those of you that do not know, is an initiative that was developed and started at the College of Nursing here, and in partnership with a local company called Precious Prince Metals. And it's been launched at East Tennessee Children's Hospital, Park West, and just recently at UT Medical Center. But the Precious Prince project actually was developed in order to help comfort grieving parents, families who've suffered a loss of a child. And they actually provide them with a sterling silver pendant that has the fingerprint of that child on it. So,
Isn't that a beautiful and wonderful thing?
So so far over 150 families have benefited, and so with this contribution in honor of Dr. Bob, there'll be at least 2 additional families that will
be able to get pendants made after a loss of their child. So, thank you.
Thank you very, very, very much. I will remember this. I will look into it. I hope that I'll be able to match this gift to the same organization. Thank you very, very much.
Thank you.
Oh no, it was $100,000.
Yes. Before we head across the hall for our poster presentations